AI has become the language of healthcare. So it's predictive, it is precise, and it's personalized. Our generation, which has inherited the worst of both worlds, if I might say. Food is medication. That's a very strong statement. Our cures are based on diet first and then supplement. I think that today, with the engines that we have particularly, we have a real chance of exactly determining what is required for you to lead the healthiest lives ever in the history of mankind. We are pushing the frontiers of AI in healthcare. In fact, our model is the second best in the planet, but frankly, ours is the best.
So we tried to kind of all these tests.
I retired, and obviously, but thankfully,
Hello and welcome to another episode of Tell Me Why, here with Golf News. My name is Lachlan Kitchen. It's good to have you along today because we have got a sensational guest that's going to make for an entertaining conversation. I'm looking forward to this. Today on Tell Me Why, we are going to be asking the question, tell me why demand for supplements and functional foods is growing in society. To answer this question and also to speak more about his incredible career is the founder of B'spoke Therapeutics, Sid Das. B'spoke Therapeutics is a global wellness brand that is expanding from right here in the UAE. It produces clean label functional foods and clinically formulated supplements that's designed for the modern lifestyles that we have. Thank you very much for joining us on Tell Me Why.
Thanks.
It's great to have you here. Sid, you're the founder of B'spoke Therapeutics. What exactly is B'spoke Therapeutics? And how are you helping people manage their health and wellness?
You see, what people are looking at is elixir of life, But I think the paradigm has changed dramatically now. A lot thanks to AI. And AI has become the language of healthcare. That's step one. And in fact, some of that push towards making AI as the language of healthcare is being done by my company, number one. So what is it that we are doing which is different from what others are? One is that the whole industry today on healthcare is about sick care. And have a heart, there are hospitals, there are beds, and well, they all have to be filled. Otherwise, it's there's no business model around it. But ours is preventive. You won't fall ill, and I say that with a lot of confidence, Kitch. One. Second is it is precise. If it has to hit something, it will hit there. Okay. So it's predictive, it is precise, and it's personalized. Our AI models, they collate around Kitch or Mira, compared to a larger population. Because there's a universe in which it is trained, collates to the universe which is inside your body. Okay. Based on that, we have these four models. One is which is predictive, which says that, well, what is the probability you'll have a CVD risk? What is the probability you'll have a lung failure or a failure of the liver? And number one. Most importantly, what is it that is required, diet, supplement, and lifestyle? That's the other engine, which will take you from, say, one, that you'll have have these symptoms and have these events, to kind of the next level where you will not have it. And the third engine which we have is a drug discovery engine, which will have precise drugs based on yourself, as I said, predictive, personalized, and precise. Okay. Which will cure you, so that, as my first statement was, for which you won't fall ill. So this is the whole model which we have.
So that's an incredible solution. But to touch on one of the points, you made that key, which a lot of doctors say, prevention is better than a cure. So when you're looking at the work you do, particularly with AI, looking at this growing demand for supplements and functional foods, is this because are we living unhealthier lifestyles? Are we wanting to live longer because we're having children at a later date than perhaps our parents? Is there something about society that's wanting us to learn more about our own health and well-being that perhaps previous generations didn't?
Well, I think that at one level, our generation, Kitch, has inherited the worst of both worlds, if I might say. At one level, the earlier generations were having much more healthier food, and food is medication. That's a very strong statement. And in fact, our cures are based on diet first, and then supplements, and then lifestyle. There is one key difference between that era and this era, though it is kind of, one loves to be a little nostalgic, but nostalgia apart, I think that today with the engines that we have particularly, we have a real chance of exactly determining what is required for you to lead the healthiest lives ever in the history of mankind. Okay, and therefore increase your health span, increase your lifespan, and feel fresh as I feel every day. Frankly, that's that's what. It's not pride. It's not it's not ego. It is something which I want everybody to kind of have when one gets it up in the morning and goes back to sleep in the
because I want to get to the story of your diet and how you live, because that's a fantastic advertisement, obviously, for looking after oneself for health and longevity. But Sid, you as an entrepreneur have been so successful. You've had all these different fields upon which you've been able to utilise your talent. But when you started B'spoke, it was founded with this vision, and the vision was to heal the planet. What was that? Was there a moment? Was there an instant? Was there something that sparked you to find a gap in the market to start up this company?
First point is that I'm not focused on competition and not focused on what others are doing. In fact, the core issue always has been compassion. And I have seen people falling off the cliff even when they have got perfectly curable diseases, and most of them have been metabolic diseases like sugar, like heart, and so on and so forth. So therefore there was always this urge in me that, look, I must have a solution. One, since that thought was always there in my mind, once AI came and I knew that, well, look, I had the tool now to kind of crack it. So I quickly jumped off whatever I was doing, and we'll talk about it at some stage, and said that, well, we had to do something at the intersection of AI and healthcare. So that was where the journey started. And the point is that that we are pushing the frontiers of AI and healthcare. In fact, our model is the second best in the planet, not anywhere, not kind of in any region, but the second best in the planet, which determines as to whether, what is your vulnerability to any kind of any disease, okay, and very importantly, how to cure it. This is tested across the world, and only the people who had made that testing, which is testing model, which is OpenAI, their model is a little better than us, but frankly, ours is the best.
Well, what makes you say it's the best?
There are these 3 or 4 dimensions, if I might say. First is that while all others, meaning the big ones, they are focused on a host of issues, we are focused on health. Our objective is clear. It's founder-led, and it has to be founder-led to have this kind of grip of things and these kind of solutions. So the first point is that, well, we are completely focused on health. The second is that we have foundation models, whereas others, the smaller ones particularly, they do not. They have, I would say, wrappers around ChatGPT. Number 2. Number 3 is we have many models, and I mentioned some of them. That we have a predictive model. Second, we have a diet supplement lifestyle to cure you. Third, we have a drug discovery engine which addresses you. Fourth, we have an AI doc which addresses you. And all of them are multimodal.
So You touched on this, so let's go through the process in this. That, as you have, I know, one of your cups of tea, which you believe in so strongly. If someone presents, perhaps they're not having any symptoms, they've hit a certain age in their life where they realise they need to start looking after themselves. What is that process? Do they then come and see you? Is it a blood test? Is it a screening? What is the process that someone goes through?
Yeah, that's a good question. In fact, all one has to do, and I reiterate, all one has to do, Kate, is join this program at 75 dirhams per month. That's kind of, when I see kind of people obese and not very healthy and having a drink, I say, man, that's my program is cheaper than that drink. Okay, so therefore all you have to take is this program. And one, if you take that, it's a beautiful app which we have. It's very user friendly, and I'll talk about the people who have designed it. All you have to do is register on the app, and then you upload any report which you have. It has to have a certain number of parameters.
You've done?
It's a blood test report which you have to upload. It has 75 parameters, and you have to upload that blood test. Once you upload your own blood test into that app, then the engines run. And once the engines run, they come up with these recommendations. We have human in the loop. That means a dedicated dietitian who takes you through this process month on month and then ensures any of your parameters was wrong or kind of negative or beyond our very narrow and very focused ranges, then all of us have to come back to that range.
And is it a situation where, obviously, if you're paying the subscription, 75 dirhams a month, you said people spend more than that on a cab fare sometimes. And then you have that opportunity where you're constantly being assessed, so then you will know whether your parameters might change or there's changes in your diet or there's changes in your exercise that you may need to take.
Yes, so therefore then this program has the following things. One is that constantly there will be a diet, supplement, lifestyle which we will recommend to you. It starts with the first month, and every 10 days or 7 days you can it will recommend a diet, supplement, lifestyle to you. The most important thing here is that the diet, whatever we recommend, aligns around you. It is not that you are a Westerner and then we have kadi chawal, recommending to you. That's what the AI, that is what is the genius of the design and the AI model. Number one. Number two is it measures. Importantly, it measures as to when you should be taking that supplement, if at all you have been taking.
As in what time of the day?
As in what time of the day.
Wow.
Number three. What is the absorption of that supplement? Your person, not kind of, not a mass. Nothing is mass. Everything is personalized. Okay. And number three. Number four is what it goes well with. Number five. What are the cofactors around it? So therefore, then what happens? Your skin, which is a vocabulary of your body, it glows. One. Second, you will never have joint pains. Third, joint or kind of particularly women after menopause, they have these issues. No, you should not be having it. I feel pained when I see women walking in and they're having joint pains. Look, I say just take my program and that's it. Leave it to me. Outsource your health to me. Kind of, as they say, health is wealth. You outsource your health to me, I'll take care. And after that, wealth is wealth. So therefore, you kind of make your wealth.
Yeah, well, Sid, I mean, you're glowing on talking about this. And I think that's a fair point, because you look at Dubai, you look at the beauty and the cosmetics industry of people that are wanting that quick fix to look good.
Yeah.
And you're here saying, obviously, that you can do that, but there isn't the magic pill. This takes time to learn about yourself, learn about what you're eating, learn about your supplements, learn about your weaknesses to give you that best result.
All these AI models, the beauty of AI models is while we, in day one, start off with the larger mass, and this model is trained 500,000 individuals who have got 10,440 parameters each. Just imagine the amount of blood works in which it is trained, number one, and plus the engine, sophistication of the engine.
Yeah.
So it's very accurate, but after that it narrows to the individual you, and everything narrows to the individual which is you. And therefore, we are so confident that you will not fall ill.
Touching on your career, you had and built a great reputation as a deep tech entrepreneur, from kind of electric mobility to obviously AI, and now you're working in wellness. When people look to transition from industry to industry, there's obviously common themes in regards to how you set up a business, how you start a business, your company culture. But was it that AI breakthrough in health that made you want to start B'spoke Therapeutics?
As a kid, when I used to take these long evening walks with my Baba and Ma, I had always been told about the Einsteins and the Newtons and the Plancks. One. So as I grew up, I was kind of looking for opportunities where I could kind of use my innovation. One. So that once I had done electric, and the innovation was done, and it was taken over by a perfectly large group which could scale it up. And I kind of sold the business for hundreds of millions of dirham. But having done that, I knew that the 1905 moment, as I say, had come in healthcare. What is that moment? That was in physics, as you remember. In 1905, when kind of Planck, Einstein and others came together, and quanta was what was discovered, if I might say. Then it explained everything in physics. Okay, so maths became the language of physics. Similarly here, AI is going to be the language of healthcare. Once that was there, all my compassion, which I had, I guess, So and the innovation, they merged together to kind of to get around the intersection of AI and healthcare.
And when people hear about this, you mentioned yourself, you might say to people, get my app, get my program. People can sometimes be a bit skeptical. They think, well, what's the difference? I have Google. I can put my healthcare. I've got my blood test. I can do all this. How do you convince people that may be skeptical about this and about your program?
We are not a marketing company. We have no marketing. We are a completely product company. We are completely substance, no style. One. Second is that, look, while others have just one model, okay, which is that you have an AI doctor. AI doctor is a minuscule part of all the models that we have, number two. Number three is that our app or our engine collates around Kitch or around Mira. And all others, that doesn't happen, number three. Number four, we have a human in the loop, okay, who will guide you. We know a human in the loop is important at this stage. At any stage, frankly.
So it's not just AI, you still need that human aspect.
It is required, that human in the loop, number four. And number five is the beauty of that app design, which will tell you no app, no other device, nothing else can tell you as to how much your absorption would be. Specifically, what time of the day you have to take. You specifically have to take it. So it's so precise, so predictive.
What are the benefits of taking a medication at a specific time of the day, whether it's in the morning with breakfast or in the evening before you go to bed?
Yeah. So for various functions, there are various nutraceuticals and foods. Now, and B is that there are several cofactors for each of these medication, if I might say, being absorbed. So there are micronutrients, there are macronutrients, and there are foods. Okay, there's a hierarchy. So some of these micronutrients get absorbed when you have some of these cofactors, number one. Once you have these cofactors, suppose your joint pain is due to a particular reason, so those joint pains, they disappear. Suppose your sugar spikes are due to a particular reason, so those sugar spikes disappear. Second point is weight, is weight or strength in your legs, in your calf muscles.
You were saying the calf is like the second heart.
I was telling you that the calf is like the second heart. If you have a strong calf, and even if you're CVD, if you have an event, then your chances of survival is close to 100%.
Oh, I've got big calves, so I'm lucky.
Yeah, very, and it needs strength training. I have inspired many of my friends to convert their living rooms into gyms, and that's the best investment they have made.
Well, they often say that the best exercise is the one that you do, and if you can have the gym just there,
Absolutely.
In your living room.
Exactly. And that's also a place to kind of meet up, and that's the time when the whole family gets around the gym, and therefore we check each other a little and taunt each other, take each other, and have these kind of fun games and so on. Some friendly competition.
What's the saying? The couple that works out together stays together, or something?
Yeah, in fact, if that is the message you can spread, Kate, that we have cracked it.
On your work with B'spoke, one of the things that you do describe your products is functional foods that are designed for modern lifestyles, because we live fast-paced lifestyles. We will have to socialise and go out. We're living differently to our parents and our grandparents. But when it comes to B'spoke, how do you address a lot of those health challenges for people, particularly in places like Dubai, where we're rushing, going, we're eating on the go, we're not finding enough time? How do you try and counter that problem?
You see, contextually, there is, if I might make a kind of true but very revolutionary statement, there is no good or healthy biscuit on planet Earth. I designed a biscuit where I linked the sugar molecules with one of my natural products, so that they became very long chain sugar. And then
Like a slow release.
Then what happened is the tummy acids, they cannot break down that sugar. Therefore, what happens is they go straight to the gut, and then lo and behold, in the gut there is good bacteria. That bacteria can break the long chain.
So it's like a probiotic sort of biscuit.
It's exactly a prebiotic. Okay, it because the bacteria feeds on it, it's a prebiotic. So as you said, so therefore the bacteria feeds on it, and man, your gut, which is again the second brain, is absolutely kind of on top of the world, and therefore your mood is great. So you have avoided three things. One is your gut dysbiosis, as they call. You have avoided that. Second, and you have got actually instead of the negatives, you have got the positive. Gut, it's a prebiotic. Second, it causes short chain fatty acids, which feed the heart. Third is that there is no sugar spike, so your lifespan does not go down by 15 minutes every time you have that, And number 4 is that you feel a little full, and therefore you have kind of less of calories during the day.
Well, because we're seeing so much around the world in regards to gut health and kind of metabolic disorders, and how that's linked to longevity, because like you said, the gut is often the second brain. Is that one of the things that you're probably most excited about?
The gut, which is very little understood. So even kind of when we run the AI engines, that's when we are understanding it. That's where we are getting to the science of it. Medicine is a practice. Medicine is not a science. And I stand by this statement. So now that we are making it a science and pushing the frontier, we see the impact of the gut on the brain. Therefore, we have got 3 dimensions in which we act on an individual. One is the phyto, which is the plant-based thing, and we have no chemicals outside, which therefore it's that much pure. Second is the vita, or the vitamins. Okay. Vitamins, micronutrients, and I include everything. And the third actually is the gut. So therefore, when you act on all 3 dimensions together, then voila, there you are.
That's the golden recipe.
That's the golden recipe, and you have to do that together. But even if you don't follow this program completely 100%, it's very easy to follow. The app is beautiful, and the way it's designed, I can talk about it at some stage. So it's very easy to follow, the app. And then the person takes you through it also.
Well, just on that app, we're seeing everyone's wearing health trackers, and they've got watches, and is the app, because of its accessibility that we're all carrying around our phones, is that one of the things that excites you most about the program?
Well, the app is just an interactive device, but there is a whole lot of technology kind of under it. And I'll just I want to explain some of the other stuff which is there, whatever it is, and people trying to do good, I'm sure. But they are kind of very narrow. They address either, for example, CVD. Man, if you do not think about diabetes, or sugar, then you're not addressing CVD. You can't address CVD in isolation. And that is where AI comes in, number one. Number two is even the rings. Well, at one level, they tell you a few things what to do. But this comprehensive way as to how you're taking a person from kind of illness and bad health to a completely kind of good health, where he or she will not fall ill, can only be done. This whole journey can only be mapped through this app. So, and that is the interactive device which we have. In addition, remember, we have a human in the loop. You see? So, I think that this is only in this comprehensive way, and we have not only thought about the engines, and there are several engines driving it. It's not one ring. There are many engines driving it, as I was mentioning to you in the beginning.
When you look at certainly in the world of health, in many countries around the world, I guess a lot of consumers can sometimes be a bit skeptical because so many people claim to make these great, just take this tablet, take this vitamin. If you're feeling tired, take this, rather than really doing the adequate research that your program certainly does. But when it comes to your approach, how do you educate the consumer? And how do you understand that there's a different approach? There's education, there's transparency, that there's a lot of factors that you need in order to both build a relationship but allow the consumer to have a program that's going to last and work?
Yeah. In fact, I think there is a right to be skeptical, number one, because I think the whole industry is geared towards one falling ill.
That's what we said at the start.
Yeah.
The idea of prevention is better than the cure, but the industry is set up there for people who
absolutely. We, by design, we are about predictive, personalized, and precise.
Mm-hmm.
So therefore, number one. Number two, if you look at our app, then the flow as to how we take you through this journey, and as I said, when, how much, what time of the day, and with what you have kind of each of these nutrients is something which is unique. Number three is that, as I said, that we have several engines which are driving to see that, well, you as a person kind of moves from one status as it is now to a new status.
Yeah, see, I remember there was a head of the World Health Organization a couple of years ago, and he used to say sometimes it's better to understand the patient than it is the disease. And I think that goes back to what you're saying, that it goes into understanding what's going on internally and how will the patient react to said doses to be able to get the best outcome.
I think that's a very important statement, and that's why I must have mentioned personalization,
Yes.
7 or 8 times now, and kind of consciously so. I really want to say that, and you see that removes two things. One is it removes the issue that, look, oh, it is genetic, man. The resignation, oh, my dad has diabetics. What can I do here? I have no other way. That is false. That is patently false. I reiterate it's false. I reiterate I can cure you, whatever your dad was or your uncle was. So that is one. And the second is that, well, today when it is possible with AI, and it's not possible with humans. Human doctors cannot do it. It's as simple as that. That's why it was a practice. Well, all can credit to them that such a complex thing had been at all tackled by humans. So therefore now this is our opportunity. And we must not let it pass.
When it comes to sort of anything from health food supplements to obviously therapeutic goods, there's a clean label movement that's growing really quickly. There's a lot of products that are out there that make big claims that maybe haven't been certified. There are some things that may not be as ethically or as naturally safe as they should be. When you make your products are US FDA registered, that's the Food and Drug Association. They're GMP certified. But when you grow as a business and you're growing to scale, how hard is it to maintain that quality and that quality control when you're suddenly scaling for a wider market?
Yeah. In fact, at one level, that the whole genesis and the whole philosophy of our work is the following, that we have to make a specific supplement or slash food for a specific person. There's no going away from that. Then if I might say, the model collapses. Okay. Second, that all our foods are done in FDA approved labs, because food is medicine. If you believe that food is medicine, then it has to be done in FDA approved labs. And number 3 is that the processes have to be exceptional to have maintain the 3 dimensions. One is the individuality of that person as to what is the specific kind of medicine or supplement or food, which has to be which that person needs. That is one, and therefore it kind of changes again with the person. And the second important thing is that, well, it has to maintain those standards. Third is the ingredients. The traceability of the ingredients has to be such that they maintain those standards.
You touched on your condition, obviously how good your hair is, but your plan is you only have 1 meal a day. Is that correct?
That's what works for me, and if for others it is 3 meals a day or 2 meals a day, that is perfectly fine. And one can be as healthy with all the parameters. For us, it's not about being fit, it's about being healthy. I have to check your parameters. We check it in day 0 and we check it in 6th month, and I kind of there'll be a dramatic change in how it has moved over the next 6 months. So it's about that healthiness. So it's not required that one has 1 meal a day. One is that the first point is that it's 1 meal a day. Second is I have a salad first with a lot of apple cider vinegar and a lot of olive oil. Olive oil, I just empty half a bottle into it.
Extra virgin olive oil?
Extra virgin olive oil, obviously, yes, absolutely. And a lot of apple cider vinegar. And the third is I don't take carbs at all, but one can have a little carb and still live with it, except the one which is in the vegetables, etc.
Sid, obviously you're the founder and you're very proud of the company, but you're only as good as your team. You've obviously got some incredible people working with you.
I think that we have got the best AI team on this planet, and definitely we are giving Zucks and others a run for their money. And I must tell you how. Look, first is that we have the AI lead who's done his thesis in multimodal under an MIT professor. So that's one. Second bit is the person who has designed this app, who's from IIT Kanpur, where kind of Zuck sorts most of his guys. Okay. And not only is he a good tech guy, but he's is a creative whiz. Under that, we have got a host of these guys. I call them the gang, a gang from IIT Delhi. Third, in the drug development engine, that has been designed a lot by Neil, the AI lead. Under him again there is Mohit, and there is Shubh and Aishwarya. I think that when it comes to comparisons across the planet, that it's a great team, and second, I think it is led a lot by it's founder led. It's led a lot by me and my colleague Subodh, who's a creative genius, and also there is a risk guy in the team called Chetan, who's also from IIT Roorkee.
Well, Sid Das, thank you very much for joining us here on Golf News Tell Me Why. I think you're an inspiration, not only because of your entrepreneurial success, of which we could do probably a whole series about all your investments, but the fact that you've gone into healthcare and you're now using your experience and modern technology to help people live their best lives. So congratulations to you, and thank you very much for joining us.
Thanks, Kitch. It's been a pleasure.
Again, my thank you to Sid Das, the founder of B'spoke Therapeutics, for joining us here on the Golf News podcast, Tell Me Why. My key takeaway from today, well, we heard it say a number of times, that prevention is always better than a cure, and it's best to understand yourself and get tested now so you understand your body and your health and wellness journey. I'm Lachlan Kitchen. Thank you very much for joining us here on Golf News Tell Me Why, and I look forward to your company on the next episode in the series.